Hi everyone, we are Group 4. I am Teklun. Today we will talk about a food poisoning event is suspected food poisoning case involving sandwich. It is reported that a sandwich shop in Tsuen Wan. Some people feel unwell after eating sandwich purchased in the shop. The first case of food poisoning occurs on May 20 of 2020, and as of May 28th of 2020, there are 80 men and 140 women ranged in age from 1 to 68 years old, about 2 to 86 hours after eating developed gastroenteritis symptoms including abdominal pain, vomiting, diarrhea, and fever. Among the 200 people involved, laboratory results showed there are samples of 12 of the affected persons and one remaining food samples were positive of Group D Salmonella.
According to the Center for Health Protection, they have found 236 patients have eaten the sandwiches containing with eggs. This is a very strong evidence to prove that the eggs may be infected during the food process. Therefore, the Center of Food Safety have tested 53 stool samples and some sandwiches sample from the store. They have found that the results were positive to the Group D of Salmonella. Salmonellas are very common in food poisoning, which can be usually found in the raw and uncooked meat, raw fruits or vegetables, unpasteurized milk and other dairy products, or raw and uncooked eggs and processed foods. And the Food and Environmental Hygiene Department have made an investigation to this case. They have found that the sanitation were very bad in the food factory, and the raw and cooked eggs were on the same workbench, and the workers did not wear gloves during working, and all the people were using the same hand towels, and the towels only cleaned once every day after work. Salmonella is a genus of rope-shaped Bacillus gram-negative bacteria of family Enterobacteriaceae. It has more than 1,800 species of Salmonella have been found, and there have 4 groups have the main factors related to the human disease. In this case, patients have found that they have diarrhea, abdominal pain, fever, and other symptoms, which is related to the Group D, typhoid and enteritis.
After talking about clinical features of bacterial diarrheal disease, let's talk about the clinical features of food poisoning. The clinical features of food poisoning are very common with other diseases. However, there are some specific clinical features for us to distinguish the features of food poisoning and other diseases. First of all, vomiting is one of the clinical features of food poisoning. Also, abdominal pain and diarrhea will also be the features of food poisoning. The patient of food poisoning may feel dizziness, or even fever when they get food poisoning. And muscle pain and palpitations are also the clinical features of food poisoning. About the clinical features of food poisoning, there are some serious problems too. For example, the patient will have blurred visions, cramps, and they may even feel very difficult to breathe. And these are the serious features of food poisoning. As I mentioned before, food poisoning can cause serious problems to us. So, we should know how to prevent infection caused by food poisoning. First, we should know how to maintain our personal health. We should maintain good personal health to prevent infection caused. There are many ways for us to help us to maintain good personal health. First, we should always keep our hands clean, and we should wash our hands and clean our hands before we having food. Second, we should wear gloves and masks when we cleaning the vomits and feces. If we have some gastrointestinal symptoms, we should take a rest and consult a doctor. Finally, patients or carriers of food poisoning should not handle food. Other than maintain good personal health, we should know how to maintain good food hygiene to prevent infection caused by food poisoning. There are many ways for us to maintain good food hygiene. Let me give some examples. First, we should drink bottled water to prevent we will have an intake of bacteria. Second, we should avoid drinking ice cups of unknown origin. Thirdly, we should buy fresh food in a reliable place. For example, we can buy food in the market that is suitable for us to rely. Also, before we eating the raw food, we should remove the skin and clean the skin first. Also, we should cook food thoroughly. And finally, although there are many uncooked food that is very yummy, however, we suggest that kids or elderly should avoid eating uncooked food to prevent infection caused by food poisoning. Moreover, we should have a habit of maintaining good environment hygiene to prevent infection caused by food poisoning. For example, we should maintain good air circulations, and we should clean vomits and feces immediately and carefully. For example, we should have a good protection of ourselves before we clean the vomits and feces. We should wear gloves and masks when we cleaning feces and vomits. Also, we should keep sanitary measures and drainage system in normal operations. And finally, we should clean and disinfect contaminated place properly.
Hi, I'm Anthony, and I will talk about this particular food poisoning event in the example we used with the Salmonella. Just a bit of the background information. The Salmonella bacteria live in human and animal intestine, which may exit the body through feces. Then the bacteria can be transmitted through air and live on other organisms. Once Salmonella bacteria gets into other living organisms, in our example, chicken eggs, they will live and harvest there. Heat is known to kill the bacteria. First, cooking the eggs completely should be the best way to remove the bacteria and make it safe for human consumption. However, in this example, when the eggs are not cooked properly and consumed by humans. The bacteria will enter the digestive system and live in your intestines. They will continue to grow and harvest. Finally, causing symptoms of diarrhea, nausea, and vomiting. People will then be diagnosed with a Salmonella bacteria infection when their feces samples are taken. To prevent food poisoning in this event, we suggest to request for the eggs to be cooked fully. Ensure all other meat is fresh, as the bacteria can live on animals. Wash hands before eating. Use sanitized eating utensils. Even when you have an infection, format dispose properly using sealed plastic bags to avoid bacteria spreading. This is the end of our presentation. Thank you.